So I wanted to welcome all of you to this session and for joining us this morning. I'm Dan Vanderbilt and I'm on staff with the Immigration Partnership. And together with BSAID, we organized this session to give a chance to you to hear and ask questions about the pandemic Safe Isolation Site and vaccine clinics. Just to let you know, in case that didn't register before, this session is being recorded, and for some of the people who can't make it today, feel free to keep your video cameras off if you prefer, or to turn them on. So that our speakers have a bit of an idea of who's in the room and kind of the perspective that they're coming at things. I'm wondering if you could introduce yourself in the chat. Just put your name if you want, and the connection you might have to an organization or group, and that'll give us an idea of where people are coming from. I'd like to start off with a territorial acknowledgement. And as people who are focused on helping immigrants and people across the community, we recognize that we're all immigrants that have settled in this place. At one point, we or our ancestors all came seeking to be welcomed and wanting to reach our full potential. A territorial acknowledgement is a way of honoring the land on which our successes have been built and the Indigenous people who have been living on and caring for this land for thousands of years. As well, it is a long-standing protocol among Indigenous peoples that honors their spiritual connection to the land. Today, we offer it as an act towards reconciliation between non-Indigenous Canadians and the Indigenous peoples of Canada. We acknowledge that the land we came to and on which we gather today is the traditional territory of the Haudenosaunee, Anishinaabe, and Neutral people. We realize that we are occupying the land that was promised to the peoples of the Six Nations in the Haldimand Tract, 6 miles on either side of the Grand River. We acknowledge the enduring presence of the Indigenous people with whom we share this land today, their achievements and their contributions to our community. We offer this acknowledgement as an act of reconciliation between Indigenous and non-Indigenous peoples of Canada. I want to introduce our speakers now. Brad Berg is the manager of the Safe Voluntary Isolation Site with the Region of Waterloo, and he's here with Laura Portagen. And then we've got Neb Zachariah, and she is a health promotion research analyst at the Region of Waterloo, and we'll be sharing about the Waterloo Region vaccine clinics. And then after the presentations, we will have time for Q&A afterwards, and feel free to put in your questions either into the chat or at that time, raise your hands, and then we'll go through the questions at that point. So without further ado, I'll hand it off to Brad.
All right, thank you, Dan. It's great to be here today. Lauren and I are going to tell you a bit about the Safe Voluntary Isolation Site. I'm attempting to share my presentation. Is that working? Everybody, okay, great, thank you. The Safe Voluntary Isolation Site is a program that's funded by the Public Health Agency of Canada. The purpose of the program is to provide people with a safe place that they can stay to help to reduce the spread of COVID-19 within their homes and in the community. There's absolutely no cost for people to use the isolation site. It is a hotel. It's not a medical setting. There are amenities and services, and Lauren's going to tell you a little bit about some of the support services that are offered to people who stay at the site. And one thing I want to note is that if a person has a child or another person that they care for, they are able to isolate together at the hotel if that's needed. I have a video, and actually maybe what I'll do, I will share that with you. Oops, just give me 1 second to share about the site. It looks like my sharing stopped. Give me 1 second here. I'll start over. All right. Okay, let me just go back to my slideshow. Okay, is my slideshow sharing again? Yeah, okay, great. Thank you.
Slideshow is not sharing, Brad.
It's not?
No.
Okay.
So I think you'll have to unshare and then share again.
Okay, thank you.
Thanks.
Okay, we're back at it. Great. So as you can see in the video, there are a few services available for people who stay there at the isolation site. So we do provide 3 meals a day provided by the hotel. There's a phone available for local calls. People have access to a TV. There's free Wi-Fi. And we do provide people staying at the isolation site with a laptop to borrow for free. There's a small refrigerator, water, coffee and tea in the room, and a coffee machine. And there are some cleaning supplies and masks available for people while they're staying there. We do provide transportation for people who need a safe place to isolate. We can provide them with transportation to and from the site at no cost. And we do use an over the phone confidential interpretation service for when we're talking with people staying at the isolation site. And Lauren, if you wouldn't mind telling us a little bit about the support services offered by Corizon for folks staying at the site.
Absolutely. Thanks, Brad. So my name's Lauren. I work for Corizon, and I am a family resource coordinator lead with Corizon. I wear many hats in that position, but one of them is to support folks isolating at the hotel. And really that means that when people come into the hotel, they are asked if they would like to receive some emotional and mental health support from a Corizon staff, which is myself and another colleague. It's completely voluntary and free. And essentially it ranges from a check-in every couple days or however often somebody might want to break up their day, understanding that it's probably a little boring sometimes. Also recognizing that this can be an incredibly stressful time for people. And so wanting to make sure that they're connected with community resources, cultural, spiritual supports, income, employment, anything. Really, if we don't know the answers, we try really hard to equip people with the right information and do some research on their behalf. But honestly, we get a mix, whether it's people that are just bored and want some check-in calls and a little bit of emotional support that way, to people who have some questions and would like to be connected with supports to address larger needs, whether that encompasses their COVID experience or further mental health needs that they might see in their life. It is open to families as well. We try to be a very family focused and family centered agency. And so while we do offer supports to the individual or family staying at the hotel, we also seek to resource people that might still be at home isolating as well, or children, kids, aunts, uncles, whoever might be considered part of that person's family at home, also recognizing that they might be experiencing significant stress and impact by COVID as well. It's received very good feedback. Again, being that it's voluntary, it's not forced upon anybody. It's been very well received, and we've had great conversations with people that have mentioned that they just really appreciate somebody to talk to throughout their day, and also had great conversations with people that they have disclosed that they have felt like they came into the hotel to address needing to safely isolate, but have left the hotel feeling like they've met larger emotional and mental health needs that they have. And I think that is all my spiel about our little blip in the hotel. But yeah, it's an honor to support folks in this way, and it's been very well received as well.
Thank you, Lauren. Yes, that's the feedback we've received as well, is that people really appreciate that support, both for themselves while they're staying there, as well as their families at home. So thank you for that. I just heard that perhaps the video I shared, the sound wasn't working. I apologize for that. I hope that the images came across still. So my apologies that the sound wasn't working there. Let me just go back to my slides here. So I want to share a little bit about how people can access the site. So the eligibility criteria is actually quite broad in terms of who can access the site. It's really anyone who needs to isolate to protect themselves or others from COVID-19. And so what this comes down to is if someone is doing the COVID self-assessment and they're told that they need to isolate, whether that be because they're a high-risk contact, maybe they have COVID, have been identified as someone with COVID, or maybe someone in their home is a high-risk contact, or has tested positive for COVID. Really, any of those reasons that they need to isolate, that they could meet that criteria for being able to access the isolation site. As well, if they don't have room or the ability to safely isolate in their home, that could be because they're sharing a bedroom, or for other reasons that they're not able to safely do that at home. That's another criteria. It is available only for residents of Waterloo Region. And then, as I said earlier, it's not a medical site, so they can only access it if they don't need any on-site medical supports. There are a few other isolation services as well. For people who are experiencing homelessness, they can contact the housing helpline. There is an isolation site available for folks experiencing homelessness. As well, for people who are traveling internationally, when they arrive in Canada, there are some federal quarantine sites that they would need to access. So the federal government has a web page for that. In terms of applying for the site, if someone needs a safe place to isolate, there's an online form that we have on our website at regionofwaterloo.ca/isolation site. Or they can give us a call. They can leave a voicemail and we'll get back to them right away. And I've got the phone number there. We are available 7 days a week and respond to emails, phone calls, and applications that we receive up until 5 p.m. And that's available 7 days a week. In terms of the length of stay that someone would need to stay at the isolation site, that can really vary. And so the amount of time would be recommended by public health. It's typically shorter than 14 days based on when a person may hear that they're a high-risk contact. And so typically they're not staying for their entire isolation period at the hotel by the time they're aware. And so often it might be, I think our average length of stay is in the like 8 to 10 day range. And as with the title of the isolation site, it is voluntary. And so a person can stay as long as they need. And if they're able to isolate at home, they're welcome to leave if they'd like. We do have room for 54 people to stay at the hotel. Well, I should say there's 54 rooms, and there are instances where more than one person can stay at a room. For example, a family, maybe a parent and a child who needs to stay together. We do have our priority for serving folks at the site includes those who are disproportionately impacted by COVID-19. And so that includes people who would identify as a visible minority, Black, Indigenous, Métis, and Inuit, those who have a family income of less than 50,000, and those who have larger households, and those who don't speak a first language of English or French. So yeah, that's our priority population. In terms of privacy and what sorts of information we need to collect, I wanted to highlight that we don't ask for a health card or proof of citizenship. And so we also don't require any coverage by OHIP or by the interim federal health program. Information for anyone who stays at the site is kept confidential. You'll notice that I haven't said the name of the hotel. That's because the site is not shared publicly, just to protect the privacy of those who would attend. Entry to the hotel is controlled and staff are on site 24/7. We have the feedback that we've received about the site has been vastly positive. So 90% of those who have attended the site have indicated that they would recommend it to others. And we've got a couple of sort of positive things that people have said there about the site. So if you have any questions about the Safe Isolation site, we do have quite a bit of information on our website. You're also welcome to email us. I also included our phone number earlier in the slides. Happy to answer any of your questions. And as I said, our inbox is monitored 7 days a week. And so we'll get right back to you if you have any questions.
I did just want to jump in quickly. I wrote down 2 points that I forgot to mention because it's Monday and I haven't had enough coffee. So we do, use interpretation services and supports as much as possible, always when there's a need for that as well. And so I wanted to highlight that, and also highlight that while the public health contact information is, office hours are 7 days a week. Ours are Monday through Friday. And so individuals don't necessarily be getting a check-in call over the weekend, but we do, as soon as we get that referral and contact information from somebody from the site coordinator, we respond within 48 hours. So we try our best to have it be a very quick turnaround. I'll also include our general email inbox for our little family resource coordinator team. If you have any questions about Horizon services or more questions specifically about the supports that Horizon offers at the hotel, feel free to connect either with Brad or his team, or also you can connect with us via that email as well. So I'll put it in the chat.
Great. Thanks, Lauren, for adding that. I just want to, before I turn things over to Neb to talk about the vaccine clinics, just wanted to say for anyone who's on the call, if you are supporting anyone who may need to access the site, please let them know about it. We do have on our website a one-pager sort of to promote the site. Hopefully we'll send it out by email as well after, to just, you could distribute that to the folks that you support. Or if you yourself at any point need a safe place to isolate, please contact us, and we'd be happy to support you. All right, I'll turn it over to Neb to talk about the vaccine clinics.
Thanks so much. Are you guys able to see my screen there? Is it up and running? Great. So thanks for having me. And as mentioned, I'm going to share a little bit about the vaccine clinics and just some pre-registration information for you all. I know that there's a lot of information out there and it's hard to keep track of it all. It's always changing. So I will give you an update as of today, and who knows what that will be tomorrow. So right now, in Waterloo Region, we have pre-registration open for eligible groups. And so that is the only way to get an appointment at one of the fixed sites. So there are a number of fixed locations throughout the region where we have vaccinations taking place. And the only way to get an appointment at those clinics is to pre-register. And I'll walk through the steps to do that, who can do that right now, and then some other options if a fixed site is not the best option for you. So right now, priority groups, we are in phase 2 of vaccine rollout here in the Waterloo region. So priority groups, it's not a comprehensive list listed here on the screen because it is a fairly large group of people who are eligible right now. But so older adults who are recipients of long-term care or in care homes are eligible. And individuals who are 55 years of age or older are also eligible to pre-register, except for those in hotspot neighborhoods. So these are neighborhoods that the province has identified as having a high incidence of COVID infections. And so in those hotspot neighborhoods, and I'll go through what the neighborhoods those are in just a moment, if you're over 18 years of age or older, you can pre-register for a vaccine at the fixed clinics. We also have a number of, all healthcare workers are eligible to be vaccinated, Indigenous adults, and we've had some Indigenous mobile clinics taking place over the last few months. Residents and staff of long-term care and essential caregivers, as well as adults who have highest risk and high risk health conditions. So there is a really long list of what those health conditions are. I won't go through them all. Those are listed on the website. But if you are one of those individuals, it's most likely that your healthcare provider has contacted you or will contact you to let you know that you are now eligible to pre-register. So if you suspect that you might fall into that category, I would recommend either contacting your physician or checking the region's website. We've got a full list of all of the conditions that would qualify as high risk or highest risk. And then the other thing is just that this list is continually changing as vaccine availability changes and we have more doses available in the region. We're able to adapt this list and include more people into this pre-registration priority group. So this is always changing. And so that might be one of the things that you're that might be causing some confusion is because one day you may hear that it's 60 plus, and then all of a sudden it's 60 or 55. And that's just because it's a good thing. It's just because we're receiving more vaccines and more people can pre-register, but it does change pretty quickly. So as I mentioned, we have some specific high priority neighborhoods in the region that have been identified for vaccine allotment. So we have Vanier Rockaway, Country Hills, Alpine Laurentian, Victoria Hills, Cherry Hill, Shades Mill, as well as the Columbia Lakeshore neighborhoods. And so again, these were provided based on provincial data as well as local community consultation based on what we know about our communities and where our local public health unit has identified the most cases and the most barriers to accessing vaccines. And I will say that likely if you live in one of these neighborhoods, you have received a flyer. So we've done some mail outs specifically for these neighborhoods, letting them know that they are eligible to be vaccinated if they are 18 years of age or older. So for the most part, those who are in these neighborhoods have heard the messaging that they are eligible to be vaccinated a little bit sooner than some of the other neighborhoods throughout the region. And as I mentioned, all of that priority population, those groups that I just mentioned are eligible to be vaccinated at the fixed clinics. So we have a number of clinics that are the sites, mass vaccination sites. We can get through large groups of people at those sites. And so they're listed here. We have to be determined at the bottom for the North Dumfries and Elmira clinics. Those are up and running. It just hasn't been updated on this slide. But again, on the website, you will have a list of all of the vaccination clinics that are available in the region. And those are also changing. We're able to open up clinics, and as vaccine availability changes, those clinics will change as well. So as far as pre-registering for the fixed clinics, that will be done on the region's website. So you have the website there at the top of the page. You can screenshot or scribble that down quickly. That's where you will go to pre-register for one of the fixed sites if you fall into one of those categories I just spoke about. And so to do that, you will need your contact information. And then you'll also need a way so contact information for the region to get back in touch with you. So when you submit your pre-registration, that's just letting the region know, hey, I'd like to be vaccinated when vaccines become available for my age group or for my population group. So you will need to let the region know how to get back in touch with you. So you could do that either through a phone call, through an email, or through a text message. Text messaging and email will definitely get you a faster response. It's a little bit quicker for us to send an email or an automated response to you, as opposed to have someone actually pick up a phone and give you a call. So if you're able, I would recommend requesting either a text or an email response. It'll just get you a link to book your appointment a little bit faster. And so, as mentioned on the slide, right now, it's probably 4 to 6 weeks for the region to get back to individuals who are requesting a telephone call. So that's the process if you're submitting a request to get an appointment at the fixed site. The other options for being vaccinated in the region, there are a few other ways that you may have heard people being vaccinated. And one of them is through pharmacies. So pharmacies, the province has given the authority to some pharmacies to give vaccines. And so in the region, we have a specific number of pharmacies that are administering vaccines. And so to get these appointments, you would contact the pharmacy directly. So that is not done through the region's online pre-registration system. That is done directly by contacting those pharmacies. And so there's a website at the bottom of the page there. It's at the Government of Ontario's website. You would enter your postal code, and then it will let you know which are the pharmacies closest to you that are providing vaccines, COVID-19 vaccines, and you can contact them directly to get a vaccine appointment. So as far as I know, in the region, pharmacies are only administering AstraZeneca. And so if you are 40 years of age or older, you are eligible to get AstraZeneca and can go to a pharmacy to receive a vaccination if you are receiving the AstraZeneca vaccine. The other option that you may have heard about are primary care vaccinations. And so that is just going to your doctor to get a vaccination. That is not open to the public, and not all primary care physicians are offering that. And so that is done on a very case-by-case basis. Some people may be able to do that, others may not. So if that's something you're interested in, I would say contact your primary care clinic or office and see if that's something that is available through them. If not, then I would recommend pre-registering through the website or through the region's website, or considering the pharmacy vaccination. So right now, this is not something that's open to everyone. It is a very specific group of people, and not all doctors are offering it. And then it would be certain patients within their practice that would be eligible. And then the final way that you could be vaccinated, or that is available to be vaccinated right now in the region, is for homebound residents. And so we have a mobile clinic that is available for those who are homebound. If you don't leave home do not leave home for personal, medical, or social reasons, the mobile team can come to you. And so that is done through a very specific request made to that team. You need to provide the information listed on the screen there, and then that's emailed directly to that team. So I don't have the email address. It's actually just an online form that you submit that you can access through the pre-registration page. And I'll show you that page link information in the next slide. So those are the different ways that you can be vaccinated here in the region. Most often, and probably most convenient for most people, is to go through the region's pre-registration process and to access the fixed sites. And that's also the process that kind of has the most steps. So I'm going to go through in a little bit more detail how you actually go through the pre-registration and what to expect as you do that. So to pre-register for the vaccine, if you're in one of those priority groups and you're willing to be vaccinated at one of the fixed sites, you would go to the region's website. Well, you could go to the website, or you could do it by phone. And the website address is just at the top of the screen there. And you would fill out a online pre-registration form. That, again, is basically just letting the region know that you are interested in being vaccinated when that time comes. If you are not able to do that online, or if you're just not comfortable, or if English is not your first language, whatever the case may be, you can call in. And so we do have the number right here. You can call in and request an appointment. There are a number of languages that are available through that call-in option. So again, if English is not your first language, you can use that option to make an appointment. Pre-registration on the website, it's not a very complicated process, but there is a video. Once you're on the pre-registration page, you'll scroll down and you'll see a big green button just saying if you want to pre-register for the vaccine. You would click on that and a form pops up. If you're wanting a little bit more guidance about exactly what to do, there's a link right underneath that. You can click that, and it's a video that will walk you through exactly how to pre-register for the vaccine. And it actually will also show you how to translate the information on the website. So all of the information on the website can be translated into a number of languages, and that video will show you how to do that. Once you pre-registered, you will be contacted after the fact to actually book an appointment. So at that time, you'll actually receive an appointment time. So you will receive a link to book your appointment. And then once your appointment has been booked, you arrive at the clinic location on the day of. And it's actually a really streamlined and really quick process. You need to bring identification with you. So it doesn't need to be a health card. You just need something saying that you are the person who is slotted for that appointment time. So it could be a passport, it could be a utility bill, so just something that has your full name on it, so we can document who's actually receiving the vaccine. Arriving no more than about 10 minutes before your vaccine is ideal. We just want to avoid crowds and lineups. Right now, as you can imagine, that's a safety precaution. And if you need to, you can bring someone with you just to go through that vaccination process with you, just either to be a physical or translation support. Most of the clinics will have staff there that can help with translation, and they do have access to a language line. So that is something that if you're feeling a little bit uncertain, they do have translation supports at all of the clinics. The other thing is that for the most part, the clinics are fairly open. Some of the clinics do have one or two stations where they can be sectioned off and give you a little bit more privacy. But the best thing to do is to wear something that you can that you can kind of ensure your own privacy while being vaccinated. So they really just need access to your upper shoulder. So a zip up sweater or something that you could just slide down so that they can get to your upper arm is ideal. After your appointment, you're going to wait typically about 15 minutes. Sometimes they'll ask you to wait 30 minutes if there are other allergic reactions that you've had in the past. But it's a really quick process. You just sit and wait for a few minutes until they have someone there monitoring the waiting area, just to make sure no one is having an adverse reaction. When you leave, we had been giving second dose appointments. Right now, just because a vaccine supply is in flux a bit, you'll likely be contacted after the fact with your vaccine appointment. So again, right now it's about 120 days, or about 4 months after your initial dose that you'll have the second dose, but that may adjust based on vaccine supply. And then the last thing is just to ensure that even after your appointment, we ask that you continue to follow public health measures. So washing hands, wearing PPE, so masking, continuing to be physically distant from others, especially those who are outside of your household, and avoiding crowds. And the last thing that I wanted to share with you, if you're looking for information just about the clinics, about vaccines, any of that, we have a lot of resources on the region's website. Actually, I'm going to go to the next page. It's a long link, but I can put it into the chat afterwards. But we have a number of resources. A lot of them are translated fact sheets, videos, information sessions. So if you are a little bit interested interested in a little bit more information about the vaccines, that's a really great place to go and get some more information. And other than that, thank you for listening. I believe that we have some time for questions, so happy to answer any questions that you might have. And hopefully you found some of that information helpful. Thanks.
Thank you, Brad and Neb. That was very informative. Thank you very much. So I would request you to either type your question in chat or raise your hand by clicking the reaction button that's way at the bottom of your screen. So Mary Perry, I'm gonna, if you could unmute yourself, please, and then ask the question and then mute back. Thank you very much.
Yes, hi. I have a question regarding pre-registration for the vaccine. So let's say a person is in the high-risk category. I think it was phase 2 essential worker as a grocery store employee. And as of May 24th, supposedly this person would become eligible in the 18+ category. So should there be just one registration on the first category, or re-register again when this age category becomes their turn?
Mm-hmm. Yeah, I would recommend that they only pre-register once. Even if others are pre-registering after the fact, they are prioritized. So this person who is eligible a little bit earlier and has already pre-registered, they would be prioritized when calling back to actually book an appointment. So just one pre-registration is required, and then they'll move through those pre-registrations and get them a booking link. Again, it'll just be based on vaccine supply, but they just need to do that once.
Next is Antigona. Sorry if I've pronounced your name wrong.
Okay, so my question is, I am 20 years old and I want to get vaccinated because by the end of the May, I'm traveling back home.
Mm.
So how can I get vaccinated, or I have to wait till the, yeah.
Yeah, so I think that the only option I think for you right now would be, depending on where you where you reside. So if you're living in one of those priority neighborhoods, 18 plus can pre-register for the vaccine right now. Otherwise, you really would have to wait until your age group becomes available to pre-register in order to be eligible to pre-register for that vaccine. So if you're living in, I don't remember them off the top of my head, but it's Victoria Hills. Hang on, let me see if I can get the list for you. But I think that if you're in one of those areas, that would probably be your best bet. So it's Vanier, Rockaway, Country Hills, Alpine, Laurentian, Victoria Hills, Cherry Hills, Shades Mill, and then Columbia Lakeshore. And again, on the website, you can actually put in your postal code and it'll be able to tell you if you're living in one of those priority neighborhoods. That's probably your best bet. Otherwise, yeah, I think you would have to wait until the province or until the region's opened up vaccinations for your age group.
Okay, thank you.
Any other questions anybody might have? Hi, Bryce, you can go ahead. You're on mute, Bryce. We can't hear you. No. Are you on phone? I think on phone there is no mic.
Am I still on mute?
We can hear you now.
I was going to, Neb knows I was going to contact a number of groups around getting vaccinations, but then I had trouble with people in my own family who were having trouble with pharmacies and they were having trouble getting a vaccination. So I haven't done anything much because I'm saying, how open are these places? And the people who were going qualified. It wasn't that they didn't qualify, they were over 40, but there was such a struggle to get a vaccination. I thought, well, are we open everywhere? Are we not open? Or where should people be going? If we talk to some of the religious leaders and the ethnic leaders, because it seemed like there were blockages to getting in.
I don't know. It is a bit of a separate process to be vaccinated through the pharmacies that's being coordinated through the province. It's not available at all pharmacies. So I guess that would be my first.
It was available in these pharmacies, but then they had trouble.
Right. Okay. So then the other thing would be, I don't know about the vaccine supply. So I don't know whether or not they had vaccine supply available at that time, if they had already given out all of the appointments for the vaccines that they had available. But yeah, I don't know the process that they're using for booking appointments at the pharmacies. It is a different process and they are managing that independently from the region's fixed site process. So that's something that I might have to look into and get back to you on, Bryce. But yeah, that's good for me to know. I hadn't heard of any challenges booking appointments at pharmacies, and we have been directing people to pharmacies if they're looking to get vaccinated but don't qualify for the fixed sites.
There were a number of people that had problems. Not only the person I was talking to, but some of the neighbors did as well around. So are the other sites, can you get in within a couple of days or a week at the other sites, like Boardwalk and Victoria Street, et cetera, or are they blocked up as well?
So there's a pre-registration process. So it's a different process there. So it takes a little bit longer to pre-register and then to get a link and to book an appointment. And there is basically a triaging or a prioritization process happening. That's not the same process at the pharmacies. So as I understand it, the pharmacies should be much faster to get an appointment just because the process is a bit different.
So I don't want to take more time, but how long should people be expected to have to wait if they're signing up for one of the
fixed
large
sites?
Fixed sites, yeah.
Yeah. The last I heard for the, depending on how you're looking to get called back, but it was up to a month.
Ooh.
but it might be moving a little faster now. But yeah, it's not an overnight thing. There is a wait time there.
Thank you, Bryce. So the next person is Salamat, but before I get there, would you please write your name and email address in chat if you would like me to contact in the future with similar workshops and sessions, and we can add you to Immigration Partnerships Weekly. So if you wouldn't mind adding your email address and contact name, that would be great. Salamavat, if you want to go ahead, please. Thank you.
Okay. Somebody taken that vaccine. After how many days that's working? It is working. After
Yeah.
how many days it's working? That's vaccine.
So I know that they say that it's up to 2 weeks before you're receiving the full benefit of the vaccine. And I mean, after a single dose, that the full benefit is not the same as being fully vaccinated, but it does take some time. And I believe it's up to 2 weeks. I would recommend checking the region's website, the fact sheets there. They'll have information from pharmacists. I'm not a pharmacist or a healthcare professional. So I'm just remembering from other sessions that I've attended. But I would say to get the exact information, I would recommend checking the region's fact sheet or website for that information, but I believe it's about 2 weeks.
Thank you.
Neb, would you have a link for the recording of a previous vaccination information that if you could please post it in chat?
Yeah, sure.
So in the region, we have had quite a few vaccination information sessions already, and they are pre-recorded and they have been uploaded on YouTube. So Neb, if you could post that on chat, and then you could watch those videos. And also there's some coming up too, right, Neb?
Yeah, there are. Most of them are in, there's different languages, and it's through the KW Multicultural Center.
Thank you. Any other questions? Any questions to Brad? Brad, is there anything that you would like to add?
Yeah, I think there's one question from Marie Pierre about is the vaccine eligibility for hotspots open to those who live and or work in those neighborhoods? I think the question is it just live, or is it live or work there?
Thanks, Dan.
Yeah, so for the hotspot, it is for those who live in those priority neighborhoods.
Okay. There are no questions in chat unless I missed any. Let me check back. And there are no questions coming. So I guess Neb and Brad did a very well job of explaining. So Dan, what would you suggest? Do we wrap up, or we're early? So that's great. We get 10 minutes. Thank you everybody for joining us. And Brad from, sorry, I'm trying.
It's okay. Brad from the region.
From the region.
Public health.
And Neb from the region. Thank you very much for joining us and sharing the information here today, which was very useful. And as we mentioned earlier, this is recording and this will go up on the Immigration Partnership website. So I'm Abiha Syed from the Immigration Partnership from Waterloo Region. I'm the Community Engagement Coordinator. Immigration Partnership works in collaboration with the community members, organizations, and business partners from all sectors. I will post a web page link on chat if you wanna wanna know more about what we do and how we do. And then my colleague, he's also the community engagement coordinator for the settlement sector. And Lauren from Horizon, thank you for joining us. Thank you everybody for joining us, and we'll see you around. Stay safe and stay healthy.
Thank you.
Bye now.
Bye.
Thank you, everyone.
Okay. Thank you, Brad. Do you have any questions?
Looks like you're still recording there. Did you want to stop that?
Yeah, I will.